Good day, grade 10. Today is our MAPEH 10 in 4th quarter final in week 5. Again, my name is Mr. Reynaldo B. Malimban. In our objectives in lesson and last chapter of our lesson is that the student is to be able to discuss health career and the steps in making personal health career plan. Prepare a personal health career plan following prescribed steps and appreciate the value in choosing health career. Planning for health career. There are various groups of workers that support the healthcare system, which involve caring for the health of an individual. Some health workers are involved in behind-the-scenes activities that support the words of the doctors or patients. Many health practitioners are legally and professionally entitled to use the title doctors, but only certain ones can dispense the medicine and perform surgery, while the other are trained to use different methods. So let's talk about the health career opportunities. In career and occupations or profession that requires special training. Why? Because this healthcare industry has hundreds of different kinds of job openings. Some jobs call many years of special training, while others required special training on the job. A technical training with required solid scientific background. And then the preparing for the health career is the education is a vital every job, especially in health career. So there are many different career in the healthcare system, and the place and length of academic preparations and training may vary on each course. So these are some jobs in which person work and learn at the same time. This is called on-the-job training. Other jobs have training period that begins after high school and lasts for several weeks or months. So the health career required the least amount of formal educations are called entry-level careers. So these include our Certified 5 Laboratory Assistants, Electrocardiograph Technicians, Control Service Technicians, Dietetic Assistants, and the Operating Room Technicians. We also include the ward clerk. In ward clerk, they receiver, visitor answer the telephones, post patient's chart, give order for a special diet and supplies and type, and records doctor's order. In health career, designed to familiarize the students with the various careers in the medical professions, allied health service. In self-assessment, it is necessary to understand one's capabilities and drawbacks. It also involves a continuous learning and improvement to grow in the chosen career path. Why? Because this is the associate degree can be earned in 2 years of college and classify an intermediate level careers. Why pursue a health career? We can pursue the career because of you'll make difference in people's lives. And then this career there are some career require formal college educations and career in the bachelor degree, and in that degree that include the medical technologies, special pathologies, physicians, health specialists, the dietitian, nutritionist, nurse, registered dentist, pharmacist, physical therapist, psychologist, optometrist, and medical technologist. So you can make your own different style people who are give her careers in that required of the degree. Now, what are some components and steps in making health career plans? So, these are things we are to consider. One is the good salary, job security, to work that interests you, find health career that fits your educational plans, a clear path to advancement, and work with people or not. In the self-assessment, what are my skills and interests? You have to discover your personal strengths through self-assessments, values, interests, personality, testing, skills, and etc. In career explorations, you can explore the different careers and work environments through career fairs, online research, meetings, internships, alumni connections, and professional resources. In career exploration also, what health career do I want to explore, or what will I do to explore the different health careers? So my decision making is this: what health career will I choose based on my skills and interest, and what do I need to consider? So before you decide on taking career that works for you, you can evaluate and narrow down your options through listing the pros and cons, comparing your personal strengths and interests, and deciding which career fulfills both current and future goals. Now, what are some plans action? What will I do to meet my goals? So, based from our plans, plan achievable goals and develop strategies to reach your goals. Organize your goals into smaller steps, identify actions for each step, utilize helpful people and resources, review and adapt your plan regularly, because many countries have expanded their commitment to health, and usually cooperations with voluntary agencies, so that health education as essential preventive health services which can be carried out in the local level, especially in school. So that course in health education is part of the teacher education program, which is the baccalaureate degree. So the teacher teach health educations in the preschool until the student reaches the secondary level. In that preparation of each student's health education will depend on his or her interest and science subjects such as biology, chemistry, zoology, and mathematics. So that is our achievable goals. According in Proverbs 19:21, you can make many plans, but the Lord's purpose will prevail. That is true. Why? Because in education of health, personal particular set of problems emerges. The medical nurse education prepares students better for work in industrialized countries. Why? Because it's a policy of migration of professional personnel to more developed countries. Career pathways. In career pathways are cluster occupations that group because of shared skills. Why do you need to understand health career pathways? Easy. Makes it easier for you to identify health career profession. And also you have to assist you in choosing health career. and you to help the develop plan on how to prepare for choosing health career. And what are some examples of health career pathways? Number 1, disease prevention and control. So you have to focus on communicable and non-communicable diseases. Their works includes immunizations, screening of newborns, promotions or breastfeeding, infant disease prevention, adolescent health care, and life skills. Second, personal health care. To perform healthcare related tasks in personal care level. Third, maternal and child care. It deals with complex public health issues that affect women, children, and their families. Why? Some infections of this also pass from this a kind of maternal child care. And many countries have expanded this commitment of health, especially in the public health. Now, speaking of that, public health is the art of the science and preventing disease, prolonging life by promoting physical and mental health, sanitation, personal hygiene, control of infections, and the organizations of health and services. Then the other one, public health includes efforts to prevent disease and promote well-being of an individual, local, state, national, and international level. Lastly, in health departments organize teams of doctors, nurses, technicians, therapists, scientists, public officials, and consumers must work together to achieve quality health care for every person. Why? Because this is our activities. Okay? For example, we deal complex public health issues that affect women, children, and their families. Like example, the midwifery. Okay? Such as in the medical care. So the special for mother and infants. And also to include that one, the environmental health program, which cover the sanitations, food and drug control, pollution control, radiologic health, housing, and urban planning. And we also include the maternal and child care to the patients, facilities, and services. That include of hospitals, nursing home, clinics, and laboratories. And other support services that include the social services, administrative services, and the nutritional services. The fourth one is the mental health care. So in mental health care, you are dealing with the interpersonal and intrapersonal relationships and life skills. Example, the guidance counselor. So that is an education, the education of health personnel that particular set of problems of emergencies. 5 is the community health care. So focus on maintenance, protections, and improvements of the health of all community members. Rural sanitary infections. Okay, so some infections may also pass from mother to the baby. So some sexually transmitted disease in the German measles of Rubella may cause problems such as deformities, brain damage, or other factors, this blindness, and or even death. So that is the rural sanitary infections. 6 is environmental health care management. Monitoring the quality of environment and impact of human activities on ecosystems and developing strategies for restoring ecosystem. Next, number 7, drug prevention and control. Now, in that case, we have to reduce community and individual problems related to the alcohol and drug abuse through evidence based from the program and policy advocacy. Next is nutrition. balance individuals, food and nutrition, and their impact of patients' health. This include meal planning, food preparations, and economics. 9. Health education. Assessing individual and community needs, planning, implementing, and evaluating health programs, promoting the understanding of various health-related behavior, plus coordinating the health education services. Number 10 is dental health. It deals with various oral conditions which include the chronic mouth and facial pain, oral sores and periodontal gum disease, tooth decay and tooth loss, and etc. Number 11 also occupational safety. It's related to the safety, health and welfare for people engaged in work or employment. And the other one is the health inspector. Number 12 is the emergency medical services. Work specialists in out of hospital medical care. Skills include first aid procedure, emergency medical treatment, and transport of patients, rapid emergency medical response, and immediate medical attention. In the medical allied health profession, we have this one, medical profession, a group of individuals qualified to practice medicine. In the allied health profession are lines of work that still deal with the healthcare but are distinct from medicine. Who are the medical and allied health professionals? One is the healthcare provider. So a person who helps identify, prevent, or treat an illness of disability. In the healthcare practitioners provider, an independent healthcare provider who is licensed to practice on and provide general and or specialist care to the specific area of the body. The allied health profession is also a trained healthcare provider practicing under the supervision of physicians or healthcare practitioner. They include the pharmacist, dental, hygienist, physical therapist, and nurses. Now, we talk about the dental health training. So that course is a dentistry. It's a degree of program with examinations. In the orthodontist is a dental specialist that strengthens up teeth. So dental hygienists provide minor oral health services that help fight a dental disease. By prophylaxis or teeth cleaning is perhaps the best known of the services. So the course of dental hygiene is 4 years degree program that requires a good background in the high school biology, chemistry, and math. So good manual coordination, flexibility, and linking to work with the people are important assets to the hygienist. And the hygienist work with the supervisions in the licensed dentist. From the dental caries, the tooth decay is a common dental disease, and the disease destroy the tooth structures and produce holes and cold cavities. That is supported into the dental hygienist. There are two categories of this profession. The one is the technician. So technicians, those are undergo training to perform specific procedures. They are required to work under the supervisions of technologists or the therapist. Technicians also, this category includes physical therapy assistants, medical laboratory technicians, radiological technicians, occupational therapy assistants, recreation therapy assistants, and respiratory therapy technicians. In technologists or therapists have more intensive training which includes acquiring the procedural skills. They evaluate patients, diagnose conditions, develop treatment plans, and understand the rationale behind various treatments. And the other way, they assist patients' responses to the therapy and make appropriate decisions. A about the continued treatment or modifications of treatment plans. Furthermore, there are licensed to perform this task. Other to Confucius, he say, work it daily is personal career cut. Choose a job you love and you will never have to work a day in your life. That's the end of my lesson. This is Rinaldo B. Malimban. Thank you.